Walter from CNA. Can I just pick up on your point about the 30,000 respiratory cases that you see generally on a daily basis? If you extrapolate that 5 days MC, maybe not all 30,000 are going to be getting 5-day MC, but a percentage of that will. Do you think the economy is going to be able to sustain every day we're basically taking potentially 1/3 of that 10,000 people out for 5 days? Second question to Mr. Lawrence. You said that if the numbers grow at a certain point, we'll stop contact tracing because it just doesn't make it, it's not meaningful any longer. It's just too large a number to trace. What is the threshold for that? Are we talking about hundreds or thousands?
Let me address the issue of the economic impact of the MCs. First, we want to explain to the employers that it is far better for these patients to stay at home and recover and rest for the good of the patients. But at the same time, it is also in the interest of the companies. Because if they cross-infect other employees in the company, they may come down with illnesses. Not necessarily COVID-19, as I mentioned, the bulk of them are not COVID-19. But if there are other employees come down with illnesses, they will end up having to go on MC as well. So I think it is far more important to keep these patients at home, let them recover before they go back to work, so that we will help to reduce the overall infection in Singapore, in the community. So I think this is something we have to explain to them. We have to get their support. We are working with the MOM and the MTI to reach out to our employers. But we do recognize that it will have an impact on the employers. We hope that they will understand that this is in the interest of public health and also in the interest of their own company operation.
Minister, if I may, perhaps I might provide some public health perspective on the question concerning contact tracing. In general, we do contact tracing because we believe that when the virus has spread from one person to another, there's still an opportunity for us, in fact, to ring fence and limit that further spread that's actually taking place. So because of that, we then find out who the close contacts are, keep them under surveillance, give them instructions not to then further have circulate, go around and potentially spreading to other people. And as we find these cases, in fact, then we would then further try and limit that further spread. So far, with regard to many of the clusters we have not seen this spreading through many generations, and it looks as if at this point in time, this containment strategy is still relevant to us. And this is still relevant in a setting where there is as yet not any widespread community transmission in the country. So contact tracing is still relevant in this sort of setting. If the circumstances change, where we now start seeing widespread spreading of this infection in the country, and then it is therefore not possible then to think about ring fencing, limiting that further spread, then a contact tracing as part of a containment strategy may not be so relevant. We don't look at it from an absolute numbers game. So it's not necessary that because I have X number of people in the country that has this infection, therefore I've crossed a particular threshold, I have to abandon these efforts. It's actually an assessment on the basis of how we see each case arising, where we think the method of transmission is, whether it still remains confined perhaps within a cluster, whether it's possible still for us to then ring fence and limit any further spread within that particular cluster. So these are qualitative assessments that we make on the basis of the information as it arises, and we make therefore recommendations therefore whether or not we think we should persist with contact tracing, with a strategy of containment, or whether we should move on to different strategies, as Minister Wong has mentioned just now.
I should also just add that this decision is taken not just on the basis of numbers, as Prof. Kenneth said, but it's also with an understanding of the nature of the disease that we are dealing with. If you look at H1N1, we raised the DORSCON levels to orange, as you all know, but very quickly we understood what the nature of the disease was. It was highly transmissible, so very hard to contain, but we also knew that the severity was not quite as high as other infectious diseases. It's more severe than a normal cough and cold, but something that could be dealt with for the acute cases, and the rest of the population who caught H1N1, then you would just see your GP. So we didn't do contact tracing for H1N1. I don't believe we did. Or even if we did, we might have stopped at a very early stage. Right? You can check the facts. But in the end, this was not the strategy. So and then we had 400,000 people in Singapore contracting H1N1 within a very short time, right? So we didn't contact trace from a very early stage, or anyone, because we knew the nature of the disease was different. It was a severe influenza, and we could deal with it in a different way. So I think today, for now, for COVID-19, we are still working on the containment strategy. It's still relevant. Countries all over the world are still on a containment strategy, and we are hoping to contain the spread of the virus. But as I said, there is growing evidence about how transmissible it is, how difficult it is to detect because it is transmissible and infectious when symptoms are mild, and how experts are already saying that that spread of the virus to other countries may already be happening, but it's undetected, particularly in Southeast Asia as well. So it's really going beyond China, because many people are asking the question, why is it that there are so many cases in China, but the cases outside China have not increased? And is it because of containment, successful containment, or is it because of we have not quite detected the cases yet, but it's really spreading? So I think we will see more evidence, to inform us what is the real answer in the coming days or even weeks. But as the evidence gathers about the nature of the disease, how it is spreading, its severity, then that will also inform or allow us to reassess our strategies together with our medical experts, and then we might decide on a different strategy and approach.